so many of our viewers know you as our medical correspondent. And I don't know if we've ever talked in detail about what it is you do when you're not at WLTX.
So I'm a cardiac perfusionist by trade. So basically I work in anything that involves the cardiopulmonary system, so heart and lungs. And in this case, right, flu season and now with the coronavirus. So this is definitely falls into our scope of practice.
So you get to see the sickest patients when it comes to respiratory illnesses.
Yeah, absolutely. I mean, yeah. And where I come in is that it's usually the last defense of care. So really it's like the last ditch effort for your lungs to recover.
Talk to us about how the coronavirus has affected the hospital system and the type of patients. I know because of HIPAA, you can't speak to anybody's case specifically, but the kind of patients you're seeing and how difficult this is as healthcare workers, this crisis.
Sure, sure. Well, it's still flu season, right? I don't want to like lose track of that too. So we have flu patients, we have cardiac patients, and now we have these coronavirus potential cases coming in. And what it's doing is just as far as, caseload, we have those patients. Now we have these potential patients. We are trying to limit staff, who's being exposed to what, just making sure things are covered. Some patients require one-to-one care. So, I mean, it is taxing on us as a staff, as far as just making sure we meet basic needs and then making sure, we don't cross-contaminate and we take full precautions. So, yeah, and I mean, I've worked 12 nights straight. So,
Yeah. So where have you been over the last several days?
So I've been in, 2 weeks ago, I started off in like the New York City area. Then I traveled down to South Florida. Now I'm out in Southern California. So areas that there's been, a little bit more activity than say the rest of the United States. So
when you see those upticks in the coronavirus in your patients, what does it look like?
So I fortunately have my patients tested negative, but I've been in the hospital with patients that who've tested positive, very similar to the flu. It's like basically results in pneumonia, acute respiratory distress syndrome. So they're very, very similar actually. So without testing is really the only way that you can, that's the bottom line, is the test is the final determinant. So very similar.
What would you say to our viewers who are watching right now, Rose? There's so much panic surrounding the coronavirus. What would you say to them today?
Well, I would say is that, these precautions are in line for a reason, because, we really want to contain this because of the burden on the hospital system, right? So we only have so many beds and so many medical professionals. And so even though it may seem that people, why are things being canceled and things, because we really want to nip this in the bud and just contain this as much as possible. I will say too, is that and remember, just in the hospital setting and what I've seen, that you want to remember if you have loved ones in the hospital, if you think you need to go to the hospital, what I do know is that there's designated entrances for employees, and for patients. And just to be patient, you're going to be screened. This is necessary because with that being said, and it's inconvenient for people, but with that being said, we are trying to identify patients through that screening. Even medical workers, we have to go through the same screening. Isolate if that's needed, if you show any sort of symptoms, and then inform. So it is protocol. It's not convenient, but and also to be aware that we're trying to minimize the flow in and out of these areas that we are only allowing one patient, just depending on the areas of the hospital, one patient or one visitor per patient per day. That's pretty extreme, except for maternity and things like that. But just to be patient and that we're looking at the big picture here. We're trying to, even if it doesn't apply to you, there could be somebody that you could infect that is a very high risk patient. So
I think this helps because our viewers understand now that when they don't see Rose on air, it's probably because Rose is in a hospital. Will you have to be quarantined as well, since you've worked within the hospital when some of these patients have been there?
That's a great question. My family has quarantined me. I'm not allowed to see them. They love me, but I'm not around them because my dad has recovering from shingles, and my sister actually just had a baby this week. Very exciting. But with that being said, I've been fortunate that I've been in an area where my patients have tested negative. Could I be quarantined? I could. I could by the end of this. I don't know how long I'm going to be needed, but I mean, I'm also on planes too. I flew yesterday. I thought, well, okay, I'm on a plane. Like, what am I going to do? You know, because I'm around people, you know, I'm just like everybody else, you know, in that situation. So.
Right. Well, Rose, thank you so much for spending a couple of minutes with us. Be safe, and we hope to see you again soon.
Oh, you're quite welcome. Happy, you know, hopefully I'll check in again.
All right, thanks.
Thanks.